One of the most important tests every woman should have is the cervical screening test, which detects early changes in your womb that could mean cervical cancer. This video will show you 6 things that could affect your cervical smear unrelated to cancer that could make it challenging to interpret your results. Hello, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. On this channel, we share health information videos to teach you all about your body and help you live well. So please take a minute to like the video if this is the kind of information that you're interested in, and kindly subscribe to the channel, click the notification bell so that you know every time we publish new videos once a week. You can get really anxious while you're waiting for the result of your cervical smear. And obviously we all want to get the news of our test as soon as possible. However, sometimes we get results back that are neither negative or positive, and so you need to have another test in order to find out what your risk of cervical cancer is. So in this video, I'm looking at 6 factors or events, some avoidable, which could affect your cervical smear result. But first, let's have a look at what is a cervical smear test and what does cervical screening mean. The cervix is part of the female reproductive system. It lies at the top of the vagina and opens into the womb. Cervical screening is a test that can prevent cervical cancer or cancer of the cervix. It is a test to see if you have changes to your cervix that have happened as a result of the human papilloma virus, HPV. A specific type of HPV, known as high-risk HPV, causes cells of the cervix to be abnormal. And in nearly every instance of cervical cancer that we know, high-risk HPV has been linked. During your cervical screening test, your nurse or doctor will take a cervical smear, which is a small sample of cells from the cervix using a small, soft brush. The cell sample is sent to a laboratory to look for any changes in your cervix, and the outcome is your cervical smear result. Now, here are 6 things that could affect your cervical smear result. Number 1, testing during your menstrual period. Avoid booking your test at this time. This is because when taking the smear, blood cells will inadvertently be collected along with cells of the cervix. They will make it difficult to see the cells of the cervix and so challenging to analyze and get your result. Number 2, avoid using a spermicide or oil-based lubricant 24 hours before the test. These may change the structure of the cells, making them difficult to analyze and affect your result. Number 3, if an insufficient sample of cells is collected during the test. This could happen because your doctor or nurse couldn't see your cervix properly, because the right size of vaginal speculum wasn't used, or because you were uncomfortable and in pain during the procedure. So it's important that you're relaxed for the few minutes that the test is going on, and please let your doctor or nurse know if you're in pain or experiencing discomfort. Things as simple as changing the size of the vaginal speculum could help to relieve this problem. Number 4, having a womb or vaginal infection. This includes sexual and non-sexually transmitted infections. In any of these conditions, the tissues of the cervix may be inflamed, swollen, and there may be discharge from the tissues as well, which could make it difficult to see the cells properly and analyze them, thus affecting your result. And number 5, we've talked about infections, but other causes of an inflamed cervix can also affect your test result. Now, outside of an infection, your cervix can be inflamed or irritated as a result of using objects like tampons, contraceptive or birth control diaphragms, as well as vaginal pessaries. Something else that can inflame your cervix and distort the cells of the cervix is if you are sensitive or allergic to certain chemicals like vaginal douches, spermicides, or even allergic to the latex rubber in condoms. And another reason you may have an inflamed cervix is if you have low estrogen or very high progesterone levels. This hormone imbalance can prevent your cervix from developing normally, and so the cervical cells appear abnormal even though the change is not related to cancer. Number 6 is your age when you're having your smear. Having your cervical smear at a younger age than is recommended can lead to misleading results, unnecessary treatment, and a lot of anxiety. And this is why cervical screening programs in many countries usually start from age 25. There are a number of reasons that led to this decision. Cervical cancer is relatively rare in women under the age of 25. Also, changes or abnormalities to the cells of the cervix that are unrelated to cancer can happen pretty commonly in women under the age of 25. As a result of this, you may end up treating a lot of these women under the age of 25 unnecessarily for cervical cancer when they have changes to the cells as a result of something else altogether. A further problem is after treating women in this age group for suspected cervical cancer, a small number of them may develop very severe problems or side effects, for example, severe or heavy bleeding after the treatment, or may even go on to experience premature birth or labor in future pregnancies. So it's essential that if you're under 25 and yet to start having your cervical smears, please watch out for any changes to the ordinary. These can include bleeding in between your periods, bleeding after sex or postcoital bleeding, as well as experiencing pain during sexual intercourse. Please seek medical advice if you experience any of these problems. So that's it for today. Hopefully this video helps you make the most out of your next cervical smear test and prevent any anxiety or confusion by avoiding any of these factors that we've talked about today. You can also join the discussion on our AskAwayHealth community forum by going to bit.ly/the community room and sharing your thoughts on this and a variety of other women's health topics. Please like the video and don't forget to subscribe to my channel. Also click the notification bell so that you know when our next video goes live. Next time we'll be talking about things you should never do while you're using the combined contraceptive method, the pill, the patch or the ring. So I hope you'll join me for that video. But while you're waiting for that to come live, check out these two here and I'll see you again soon.